2 years ago, your vision was perfect. You read menus without squinting. You drove at night without gripping the wheel. You climbed stairs without hesitating. You stopped thinking about your eyes at all. For about 18 months, you forgot you had ever had cataract surgery. And now, somewhere between 16 and 30 months out, the fog is back. Headlights have started haloing again. The morning light through the kitchen window looks softer, milkier than it used to. Reading the bottle of your blood pressure medication takes longer than it did 6 months ago. And you have started doing that thing you swore you would never have to do again, tilting the page, turning on the second lamp, closing one eye to see if it is worse on the right or the left. And your first thought is the thought every single cataract patient has at exactly this point in the timeline. Did the cataract come back? I want to be straight with you before we go one sentence further. It did not. Anatomically, it cannot. The cloudy lens that was inside your eye was removed during surgery, and a clear artificial lens was placed where it used to sit. That cataract is gone. It is not growing back. It is not hiding. It is not returning. But something else has happened. Something that affects roughly 30 to 50% of cataract patients within 5 years of surgery. Something most surgeons do not sit you down and warn you about before they wheel you out of the operating suite. Something with a clinical name that almost no patient has ever heard until they walk back into the consultation room scared. It is called Posterior Capsule Opacification, PCO for short. It is sometimes called a secondary cataract, though that name is misleading, because it is not a cataract at all. And in the next several minutes, I am going to walk you through exactly what is happening inside your eye right now. The 5-minute in-office laser procedure that fixes it permanently. The one specific situation where I would tell you to wait before scheduling that procedure. And the rare risk you should know about, even though it almost never happens. I am your doctor, your senior vision wellness educator. I have spent years helping seniors understand what is actually happening behind the words their surgeons say in the 6-minute follow-up appointment. And I want to be clear about why this video exists. Almost no one on the internet explains posterior capsule opacification in plain language to the people who are about to panic about it, so I am going to. If this is your first time here on Senior Diet Coach, subscribe. I post a new video every single day on senior health, real biology, no miracle cures, no supplement sales pitch. And before we go further, type in the comments how long it has been since your cataract surgery. Just the number. 6 months, 2 years, 4 years. I want to see the timing pattern across this audience. Here is what is coming, in order. First, the anatomy. What the capsular bag actually is, and where your artificial lens sits inside it. You cannot understand what is happening without this piece. Second, the actual mechanism. Why this is happening, why it has absolutely nothing to do with the cataract coming back. And why the timeline is almost always somewhere between 6 months and 5 years after surgery. Third, the 4 assumptions almost every patient walks in with. Every one of them is wrong. Fourth, the 5-minute YAG laser procedure, what it feels like, what the day before looks like, what the day after looks like. Fifth, the one situation where I tell people to wait before scheduling. Sixth, Margaret, a composite patient, illustrative, but the pattern is one I see over and over again, and exactly what her timeline looked like, from the first foggy morning to the day the fog was gone. Before I go further, I want to draw a very clear line. There are vision symptoms that mean stop watching this video and call your ophthalmologist today. Not next month, not next week, today. Sudden vision loss in one eye over hours or a single day, that is an emergency. A dark curtain or shadow crossing your vision, especially combined with flashes of light. That is an emergency. This one matters more after cataract surgery, because the surgery itself slightly increases the lifetime risk of retinal detachment, and detachment can present exactly this way. Sudden severe eye pain combined with nausea. That is an emergency, possibly angle closure glaucoma. If any of those 3 describe what you are experiencing right now, stop this video and call your eye doctor today. Posterior capsule opacification does not present that way. PCO is gradual. It is painless. It creeps in over weeks and months. If your vision has slowly become foggy over months. If headlights now have halos that they did not have a year ago. If reading is meaningfully harder than it was when you first recovered from surgery. Then stay with me. That is exactly the pattern this video is for. Let me give you the anatomy, because nothing about posterior capsule opacification makes sense without it. Inside your eye, behind your iris, your natural lens used to sit inside a structure called the capsular bag. The bag is a thin, transparent envelope, almost like a soft cellophane wrapper around the lens. Front wall, back wall, two flexible halves that meet at the equator of the lens. During cataract surgery, your surgeon opens the front wall of that bag, removes the cloudy lens material through the opening, and places the new artificial lens inside the bag. The back wall of the bag is deliberately left intact. It has to be. That back wall is what holds the new lens in position and keeps the inside of your eye stable. That back wall, the posterior capsule, is what becomes cloudy. The bag stays, the lens stays, but the back wall of the bag, the thin, clear membrane sitting just behind your artificial lens, slowly loses its transparency. Light passing through it scatters instead of focusing cleanly on your retina, and the result is exactly what you are experiencing: gradual fogginess, halos around lights, reduced contrast, and the very convincing feeling that the cataract has come back, even though it has not. Now, the mechanism. Why does the back wall of the bag go cloudy in the first place? During the original surgery, your surgeon removes most of the lens material, but a small number of cells called lens epithelial cells remain attached to the inside of the capsular bag. These are normal cells. They are not abnormal. They are not dangerous. They are not the result of any complication. They are the cells that originally built your natural lens when you were a child, and they are biologically programmed to do exactly one thing: grow. In the months and years after surgery, those remaining cells slowly migrate from the edges of the bag toward the center of the back wall. As they move, they multiply, and they begin laying down their own protein. That protein is not perfectly transparent the way the original capsule was. It scatters light, it accumulates, and over 6 months to 5 years, depending on the patient, it accumulates enough to start affecting your vision. This is not something you caused. It is not because you did or did not do something in the months after surgery. It is not because you used your eye drops too much or not enough. It is not because of how you slept or what you ate or whether you rubbed your eye. It is the normal biology of the lens epithelial cells doing what they are programmed to do, in a place where the surgeon could not safely remove every last one of them. Now, here are the 4 assumptions almost every patient walks into my consultation with. Every single one is wrong. Assumption 1. The cataract has come back. No, the cataract was removed. Anatomically, it cannot return. What is clouded is a different structure entirely. The back wall of the capsular bag, not a lens. Assumption 2. I need another full cataract surgery. No, the fix is not a surgery. There is no incision, no recovery time, no general anesthesia. It is a laser procedure done while you sit in a chair. It takes about 5 minutes. You walk out the same day. And the vision change is usually visible within hours. Assumption 3. If I wait, it will go away on its own. It will not. Posterior capsule opacification is a one-way process. The cells keep migrating, the protein keeps accumulating, the vision keeps gradually fogging. Waiting does not reverse it. Waiting just lets the fog get worse. Assumption 4. Once I have the laser, it might happen again later. This one is the most reassuring to correct. Once the laser opens a small clear window through the cloudy back wall of the bag, that window stays open. The cells cannot reclose it. The fix is permanent. You are done with this problem for the rest of your life. Now I want you to pause for a moment and do an actual self-test. This will tell you whether posterior capsule opacification is the dominant problem in your current vision, or whether something else is also going on. You will need an object across the room with high contrast. The title on the spine of a black book at about 10 feet works well. A clock face across the room works well. Stand in normal indoor light. Cover one eye completely with your hand. Look at the object and rate the sharpness from 1 to 10. Then switch hands and cover the other eye. Rate the same object again. If the eye that had the surgery is now rating 2 points or more lower than the other eye, and that difference was not there in the months right after surgery, you have a strong PCO signal. If both eyes rate equally low, the problem may be PCO in both eyes, or it may be something other than PCO. Either way, the next step is the same. Call your ophthalmologist office and ask specifically to be evaluated for posterior capsule opacification. Use that exact phrase. Posterior Capsule Opacification, or PCO. Saying the name in the phone call moves the conversation past the brochure language and tells the scheduler that you know what you are asking about. Now, the procedure itself. The fix is called YAG laser capsulotomy, YAG, 3 letters spoken individually. The Y stands for yttrium, the A for aluminum, the G for garnet. Those are the crystals in the laser. You do not need to remember any of that. You just need to know that this laser has been the standard PCO treatment for nearly 40 years. It is not experimental. It is not new. It is one of the most performed procedures in ophthalmology in the world. Here is the procedure, start to finish. You arrive at the ophthalmologist office. They put dilation drops in the affected eye, sometimes also a numbing drop. You wait about 30 minutes for the pupil to fully dilate. You then sit at the laser, which looks very similar to the slit lamp microscope you have already sat at during every eye exam you have ever had. You rest your chin on the chin rest, your forehead against the strap. The doctor places a small contact lens on your eye to keep it open and focused. There is no pain, just a mild sensation of pressure. The doctor then fires the laser through the cloudy back wall of the capsular bag, making a small, clear, circular opening directly behind your artificial lens. The opening is just large enough to let light pass cleanly through. The bag stays in place. The artificial lens stays in place. Only the cloudy portion of the back wall is opened. Total time at the laser is usually 3 to 5 minutes. Total time in the office, including check-in, dilation, and a brief post-procedure pressure check, is about 90 minutes. You walk out the same day. You can be driven home, or you can drive yourself if your eye is not too dilated. Most patients see meaningful clarity within hours and full clarity within a day or two. There is no incision, no stitches, no bandage. You can shower, exercise, read, and drive normally the day after. The eye drops you may be prescribed are a short course of anti-inflammatory drops for about a week. That is it. Now, the rare risk most patients are not told about. After YAG laser capsulotomy, there is a small temporary spike in the pressure inside your eye in some patients. That is why your ophthalmologist will check your eye pressure about an hour after the procedure before letting you leave. If the pressure has risen, they will give you a pressure-lowering drop. This is routine. It resolves within hours. The more serious but still rare risk is retinal detachment. Cataract surgery itself slightly raises your lifetime retinal detachment risk, and YAG laser capsulotomy adds a small additional increment to that risk. The absolute risk is still low, somewhere between 0.5% and 2%, depending on your baseline factors. The risk is higher if you are extremely nearsighted, if you have had a retinal detachment in the other eye, or if you have a family history of retinal detachment. If any of those apply to you, mention them to your ophthalmologist before scheduling the YAG. They will still likely do the procedure, but they will monitor you differently afterward. There is one situation specifically where I would tell a patient to wait before scheduling. If you have active swelling in the center of your retina, called macular edema, or if you have active inflammation inside the eye, those conditions need to be treated first, because the YAG can temporarily worsen them. Once they are stable, the YAG is safe to proceed. This is not a permanent no. It is a not yet. Let me tell you about Margaret, composite patient. Illustrative, but the pattern matches what I see routinely in post-cataract follow-up. Margaret is 71. She had cataract surgery on her right eye at 69, and on her left eye 6 weeks later. For about 18 months, her vision was the best it had been since her 30s. She put away her reading glasses for everything except very fine print. She drove at night without thinking about it. She told her family that the surgery had been the best decision she had made in her 60s. About 22 months after her right eye surgery, she began noticing that the right eye was slowly fogging. Reading the bedside clock at night had become harder. The street light outside her window had developed a soft halo that had not been there before. She covered her left eye and looked at her television. The picture was clearly less sharp than what her left eye was seeing. Her first thought, like every patient at this exact point, was that the cataract had come back. She spent about 3 months not calling anyone about it. She just quietly adjusted, held her phone a little closer, sat a little nearer to the television, told herself it was probably just her age. When she finally called the surgeon's office, expecting bad news, the diagnosis took less than 2 minutes at the slit lamp. Clear posterior capsule opacification in the right eye. Early signs in the left. The surgeon scheduled the YAG laser for both eyes over 2 appointments, 1 week apart. Each procedure took under 5 minutes at the laser. Margaret drove herself home from the second one. Within 48 hours of the first laser, the right eye fog was gone. Within 10 days, both eyes were sharper than they had been in a year. Margaret had been carrying that fog, and the quiet fear that her surgery had failed, for about 6 months before she made the appointment. The whole problem was resolved in 2 visits. 3 habits that delay PCO diagnosis even after the symptoms have clearly started. The first is assuming the fog is just part of normal aging. It is not. Cataract surgery should hold your post-op vision quality for many years. If your vision quality is meaningfully declining between 1 and 4 years post-op, the single most common explanation is PCO, and the fix is the YAG laser. The second is waiting for the next routine annual eye exam. PCO does not need to wait for an annual exam. Call your ophthalmologist office, describe the symptoms specifically, and ask for an evaluation for posterior capsule opacification. They will fit you in within a few weeks at most. This is not a "we will see you in 11 months" situation. The third is going to an optometrist for a new glasses prescription. New glasses will not fix PCO, because the problem is not focus. The problem is the scatter of light passing through the cloudy capsule. A new prescription will give you sharper words on the eye chart for about a week. And then the underlying fog will continue to worsen. You will have spent $300 on glasses that solved nothing. Here is your action protocol. Start it today. Step 1. Do the covered eye self-test I described earlier in this video. Rate each eye on a black object at 10 feet, 1 through 10. Write the numbers down. Step 2. Call the office of the surgeon who did your surgery or the ophthalmologist currently managing your eye care. Use the exact phrase, "I would like to be evaluated for posterior capsule opacification." Step 3. At the appointment, ask 3 questions. Is the diagnosis PCO? Am I a candidate for YAG laser capsulotomy? And are there any reasons specific to my eyes, such as high nearsightedness, prior retinal issues, or active macular swelling, that I should know about before scheduling? Step 4. If the YAG is appropriate, schedule it. Do not wait 6 more months to think it over. The procedure itself is brief. The recovery is essentially nothing. The vision change is usually noticeable within hours and complete within days. Step 5. After the YAG, return to your normal routine. There are no long-term restrictions. There is nothing you have to avoid. The fix is permanent. You do not have to think about this again. If you have been quietly suffering with post-cataract fog for months, this is the resolution. It exists. It is simple. It is in office, and almost nobody talks about it. Before you go, I want to know 2 things. First, how many months or years out from cataract surgery are you? Just the number. The timeline pattern across this audience will shape what I cover in the next video. Second, has anyone in your ophthalmologist's office ever mentioned posterior capsule opacification to you before or after your surgery? Yes or no? I want to see how widespread the warning gap actually is in this community. To recap, in case you came in late, the fog that returns 1 to 5 years after cataract surgery is not the cataract coming back. It is posterior capsule opacification, cloudiness of the back wall of the capsular bag. It affects 30 to 50% of cataract patients within 5 years. The fix is YAG laser capsulotomy, 5 minutes at the laser, 90 minutes total in the office, no incision, no recovery, permanent result. The one situation to wait is if you have active macular swelling or inflammation that needs treatment first. Use the exact phrase posterior capsule opacification when you call. It moves the conversation past the brochure language and gets you scheduled faster. Make the call this week. And if you know someone whose vision has been quietly fogging months or years after their cataract surgery, send them this video. They have almost certainly been carrying the same fear Margaret carried, and they have no idea the fix is one laser appointment away. I am your doctor. This is Senior Diet Coach. Subscribe for a new video every single day, and take care of those eyes.